Hey everyone, I've been learning German for a little over a year now with Chatterbug, and I thought it would be interesting to.
So, good morning, everyone. Right. Okay. So I'm just going to type in here, good morning in Germany. Well, actually, let me just put hello from Germany. Hello, everyone. I can say good morning from Germany, but instead I'll just say hello because I know there are going to be people who are watching this from all over the world. Right now, it is a somewhat cloudy Saturday morning here in northern Germany. But I am here this morning to just do another session with you, just what we call our 30-minute classroom on a topic that I know people are usually having problems with continuously in English. Now, if you are doing OET, and many of you that watch this will be, this is going to be particularly important for your writing and speaking. And if you're not doing OET, you just want to improve your general medical English, then this is also a very important topic in any case. So the topic that I'm talking about, you guys would have seen the title, is English tense forms. And it's important in healthcare, as you know, because, or as you may not know, because in English, tense forms don't just say if something happened in the past or the present or is going to happen in the future, but it also implies a lot, okay? So for that reason, I thought I'd just take a few minutes this morning to go over tense forms. Now, this is not intended to be a full lesson in all the tense forms of English. Rather, this is to, one, introduce you to the ones that are most common in healthcare, that you need to use the most often in healthcare, and to show you why it's important to get it right, why it is important to not cause confusion. So then in your own further study, you can look up some of the terms that you see here, some of the tenses, some of the examples, study them more, practice more, and that way be more confident in your communication with patients, with concerned relatives and caregivers, and with your colleagues, so that there is no miscommunication in healthcare. Okay, so on that note, what I am going to do is I am going to now start my screen share. So if you will just give me a minute. And you know, for me, my minute usually lasts a little long. Okay, hold on. I got the wrong screen there. That's very typical of me. Okay, here we go. Right. So this morning, I'm going to offer a little help with English tenses. Okay. So as you know, and there is Tanvi helping me to keep you on track, there are 3 different, you can call it timelines, that you need to cover in any language, including in English. And that is the present, the past, and the future. But English being English, we like to complicate things a little bit. And in each of these, we actually have multiple forms that you use. Okay. So for example, for the present tense, we actually have two different present tense forms. There's one present tense form that we use if we're talking about general stuff. Okay. These are routine things that happen all the time, like habits that you have, or general facts of nature, like grass is green. Okay. And then we have another present tense form for things that are happening right now, like me talking to you right now. Then we come on to the past, and in the past, unfortunately, I'm very sorry to say, we actually have multiple tense forms for the past tense, depending on when things started, if they happen once, if they happen multiple times, if they're still going on now, if the effects of them are still going on now, and so on and so forth. I'd like to say that there's a quick, easy little way to figure it out. There isn't. You just have to understand the different situations, read a lot, listen a lot to English speakers, and kind of get a sense of when we use which tense form. However, as a general rule, we have one kind of tense form for when things are happened in the past. And for us, the past can be 5 seconds ago or 5 years ago. In English, the past is anything that isn't right now. So something that happened once and is completed, it's done. That's one tense form. Then we have another tense form for things that started in the past, but are ongoing. Okay, so they started and they're still ongoing up until now. And then we have another kind of tense forms to talk about things that happen over a period of time in the past up until a certain point in the past. Now, I know that can get a little confusing, so let me just repeat it. We have two different forms for things that started in the past and are ongoing. There's ongoing up until now, but then there's ongoing up until a certain point in the past. Okay. Now, I won't talk about all of them because that's just too much for 30 minutes, but I will talk about the ones that are most important, most often used by you in healthcare. Okay. So that's the past. And then in the future, we have two different forms, and there's a lot of, well, there's some argument about when you use which, but fortunately in the future, we keep it to two tense forms for predicting things and for planning things. And again, for us in the future it could be a minute from now. It could be a year from now. It could be a decade from now. In English, the future is anything that is not right now. Okay. So let's look at exactly what these forms are. Okay. So for routine things, what you do every day, for example, I arrive on the ward at 6:30 in the morning. We have teaching ward rounds twice a week. We have grand rounds or interprofessional rounds once a month. We use, that's for routines, things you do all the time. We use the simple present, as you just heard in the examples I gave. Don't worry, you're going to see some examples in the next screen as well. General issues like generalizations. For example, people in healthcare tend to work very long hours. That's a generalization, okay? And facts, things like measles, mumps, rubella, and COVID-19 are infections, okay? Those are facts. There's no question about if they're an infection or viral infection. They are. And for that, we use the simple present. However, if we're talking about what we're doing now, then we use another form called the present progressive. So right now, I am talking to you about tense forms and why they're important so that your meaning is clear and accurate, okay? Right now, the world is dealing with more and more infectious epidemics, okay? Right now, we are using digital technology more and more to help us in our everyday. We are using, they are dealing with, I am teaching. We're talking about what's going on right now in this very minute, okay? Of the past tense forms that you will be using most often, we have the simple past, and that is the one you use when something happened in the past and it's done. Okay, so for example, last year I worked very hard. Last year's done, it's over. Okay, I turned on my computer this morning at 5 minutes after 8. Okay, I turned on, that's a one-time event. Yes, I know I'm still on the computer, but I turned it on, the actual turning on, it happened at 8:05. Okay, simple past tense. Now, the challenge with simple past tense is in English, we have regular verbs and irregular verbs. Regular verbs, the simple past tense ends in ed, worked, talked, shared, but we also have irregular forms, was, were, had, and so on. Unfortunately, you just have to learn them. There is, again, no shortcut, no pattern. The other past tense form we have is when something started in the past, but is ongoing still. And for that, we use the present perfect. We will see examples soon. And present perfect progressive. You may also see present perfect continuous. It's the same thing. It is exactly the same thing. Okay. It just depends on if you're on the British side of the Atlantic or the American side of the Atlantic. Okay. So present perfect, an example which you will see is things like, I have taught English for 8 years or 7 years, okay? Have taught. Or you can say present perfect progressive, I have been teaching English, okay? You may say he has been working at that hospital since 2020, or you can say he has worked at that hospital since 2020. And then we have another form for things that are ongoing up until a certain time in the past, and that is the past perfect, or again, the past perfect progressive or continuous, okay? And in this case, we say he had taken his medication regularly up until last month. So the stopping point in the past was last month, okay? So we say he had taken his medication regularly up until last month. Or we can use the progressive form, he had been taking his medication up until last month. So for the future then, we have also two forms, which most people will be familiar with, will and going to. Now, there's lots of question when you use will, when you're saying that something is inevitable, it will happen, versus when you use going to, if you're talking about you're planning something. I'll be honest with you, in real life, in everyday speaking, the average person does not differentiate between the two. Academics do and language specialists do, but in everyday conversation with patients, with colleagues, with caregivers, will are going to mean the same thing. Okay, so let's look at some examples. But before we do that, tenses are important, first of all, for correct grammar. You do not want your grammar to be so bad that people are listening to you and going, huh? They're paying more attention to the grammar, the bad grammar, than they are to what you're saying. Okay, so you don't want your listener to be distracted or straining to understand what you're saying because your grammar is all over the place. But also tenses are important because what they imply about the timeline and the urgency of situations. And you can see that this would be extremely important in healthcare, extremely, okay? So rather than describe it, what I will do is I like to use an example. And the example I like to use is a pregnant woman. She's 28 weeks pregnant, gestation, and she comes to the emergency department. Okay. Now, yes, this is a medical setting, but if you're watching and you're in pharmacy or physiotherapy or any other occupational therapy, any other healthcare profession, this is a situation that you can be familiar with. Okay. All right. So let's look at what happens if she uses the simple past, the meaning, and your response if she uses the simple past. She says, I bled. Well, your understanding of that is it happened once, likely for a very short time, and it's over. Okay. Now she's pregnant, she's 28 weeks, so she's kind of just on the borderline. You want that baby to stay in a little bit longer so, you know, the lungs can cook and the liver can mature and what's not. So you have to talk to her in more detail, but maybe you are on if you're in emergency department, maybe there was a huge traffic accident. You've got somebody also in status asthmaticus. You know, there's lots of things going on and you have to triage, you have to prioritize who is seen the most. Now, this person, again, has to be seen, but they can wait a little bit, okay? Because her situation is stable. She's not bleeding anymore based on what she said, I bled, okay? So you put her down, you have her a few minutes, and when something frees up, then she's next up to go in. But she comes in now, scenario 2, and she says, I have bled. Now, again, we get the idea that maybe it's over for now, but there's the impression that the bleeding and the spotting may have happened once, but it may have been intermittent. It may have been come, go, come, go, come, go. Right now, as she's speaking to you, she might not be actively bleeding or spotting. But it happened probably more than once. So you're even a little bit more worried. And you're worried that there are lingering effects. What impact is it having on the baby? And of course, the mother, she's going to be anxious. So immediately standing there, you want to ask her quite a few more questions. How often did it happen? Because there's the idea that it may have happened more than once. How long did it last each time? How long ago was the last episode of spotting? How much did you spot? Okay, because there's the impression with I have bled that this isn't a one-off. It didn't just happen once, okay? So this one is somewhat more urgent, okay? But then we have two situations where you kind of perk up a little bit more. She says, I'm bleeding. Now, what that means is it's happening right now. Okay. Yes, it started sometime before. It could have been a minute before. It could have been, you know, an hour before. But in any case, it is happening right now as she is speaking to you. Okay. So while you're asking her questions, you are getting her on the bed. you are strapping her up to the ultrasound, you are getting the fetal heart monitor going, because this woman is bleeding right now and you need to know what is going on. Okay, you need to see for yourself what is going on. Right. So this one, as you can tell, yeah, the urgency level went up a little bit more. And then, or then she comes in and she goes, I've been bleeding. Now this one, immediate action. Why? Because of what it implies. It implies that this started some time ago, it was ongoing, and it still is ongoing right now. Okay. It may have been that there was no pause. That's the implication. Okay. That it started bleeding. She's spotting, bleeding. Maybe it's getting worse, whatever, but it's going on right now. And this pregnancy is at immediate risk. Or in any case, this is how you think and how you should think, especially if you are dealing with a native English speaker. Okay. All right. So this is what I mean by tense forms also imply a lot, not just about timeline, but how urgent the situation is. Okay. However, having said that, it is not always the case that different tense forms mean different things. There are some times when it means the same thing. For example, in the simple past, do you take your medication regularly? The meaning is what you are asking the patient now. And in this situation, now it's you discussing treatment with the patient, whatever that treatment is. When you ask the patient, do you take your medication regularly? You're asking the patient if they're compliant now or usually. So you're talking about a regular thing. Sorry, this is, this is simple present. Oops. Sorry, guys. Yeah, that is a typo. So much so, and it's an important one. So if you will bear with me, I'm going to stop sharing. I'm actually going to correct that very important typo here. This is not simple past, this is simple present. It's a very important typo. I didn't realize. Yeah. So let's screen share again. Yeah, that was important enough to make the correction. Yes. Yeah. Okay. So you say to the patient, do you take your medication regularly? It's simple present. Again, sorry. What you mean is the patient compliant now or usually? But in this instance, if you use the present progressive, it means the same thing. Are you taking your medication regularly? Means exactly the same thing in this instance. All right. Similarly, if you use present perfect versus present perfect progressive, how long have you taken this medication? You're asking them, when did you start this medication? Assuming that they're still taking it. Okay. But if you use present perfect progressive, how long have you been taking this medication? In this instance, means exactly the same thing. When did it start? And we're assuming you're still taking it. Okay. And this, when it comes to how you form the simple present, once again, you just have to learn the different forms. Present progressive, the present tense of the word be. So I am, you are, he, she, it is, we are, you are, and the ing form of your main verb. So here it's you, so it's you are, but we switch it because it's a question. Are you taking your medication? Present perfect. How do we form it? We form it with the present tense of have, which is I have, you have, he, she, it has, we have, they have. And in question form, we switch the you and the have. So have you plus the third form of the verb. And the third form of take is taken. So have you taken this medication? and present perfect progressive, have you plus been, and it is always been, okay? Plus third form of the verb. How long have you been taking this medication? Is the present perfect progressive, and it means the same thing, okay? So you're going to ask the question, but how do I know when it means the same thing and when it doesn't? Again, this is just something you have to learn, okay? Through practice yourself, through reading, and through listening to other native English speakers using the language, okay? So let's look at, if you're doing OET, let's take a look at some examples of tense errors in writing, for example. Thank you for seeing this patient who has angina pectoris. He had hypertension 3 years ago and is taking ramipril. Okay, now here's the problem with saying he had hypertension 3 years ago. The meaning is that he no longer has hypertension. Why is it confusing? Because you said he is taking ramipril, which means he's still taking medication for it. And hypertension, as you know, is a lifelong companion for those who have it. Well, usually anyhow. So this is the wrong tense form to say he had hypertension 3 years ago. Instead, you use a tense form that shows that it started in the past, but it's still ongoing now. He has had hypertension for 3 years. Or you can say he has been hypertensive since, and you give a date, since 2018, okay? Because this then makes more sense when you go on and say, and is taking ramipril, okay? Let's try another one. Mrs. Ronald has been having surgery on her right toe. Now, this is something actually that I've seen a little too often in people's writing. So if you are doing OET, and any of my students are watching, please go back to your letter. If you've got a letter you're about to send to me, and if you've made this mistake, please correct it before you send it, because you know what, I'm going to send it back to you with a big red correction on it. Mrs. Ronald has been having surgery on her right toe. The reason why this is wrong is simply because to an English speaker, the image is that she's having surgery all the time, every day. The surgeons are standing over her 24 hours a day, operating on her foot every day. And we know that that's ridiculous, okay? Because the truth is she had the surgery once and the surgery's over, okay? So our language reflects that. It either is she had surgery on her right toe, and then you give a date, 2018. Or you can use present perfect. She has had surgery on her right big toe. Okay, now for this one, you don't have to give a date because we're just talking about a general experience she had. Our argument in English is that she had the surgery, she'll always have the scar, so she'll always have the experience. So we can use present perfect. Another one, at her appointment last month, pay attention to the last month, she said she has had pain for 3 days. Why is this confusing? Because if you say she has had pain for 3 days, that is present perfect. That means you're talking about up until the present, up until today. So you're saying that she had pain for the 3 days before today. But you're in fact talking about last month. You're talking about a point up until the past. So the correct version is, at her appointment last month, she said she had pain for 3 days. So say the appointment was August the 15th. That means she had pain August the 12th, August the 13th, August the 14th. The 3 days before the appointment. Okay, and we're stopping, our thinking is stopping at August the 15th. Okay, so just remember that. So those are errors that I see in my students in OET writing, and some of these also occur in speaking. Do you take anything for your symptoms? Often students say this thinking that they mean, okay, did you take anything right now? Or okay, let me be clear. Yeah, like, did you take something this morning? Do you have something in your pocket right now? However, what the patient is going to hear is the medication regular? Okay, so do you take anything for your symptoms? It doesn't necessarily mean that for this episode, they took something. So they're thinking, well, yeah, you know, let's take asthma. Yeah, I usually use a salbutamol inhaler and Pulmicort, but it doesn't mean that they used it for this episode. So you have to be very specific in the tense form you use in your questions, at least if you're dealing with an English speaker, okay? Did you have physiotherapy? Now, the meaning of this is any physiotherapy at all, even one episode. So a patient, and we know patients sometimes, you know, they fiddle the truth. Did you have physiotherapy? The patient could say to you, yes, I had physiotherapy, but it could mean that they went once and never went back, even though they were supposed to go back, okay? So if you want to know if they have been compliant with their physiotherapy, you need to go, have you been having physiotherapy? Because from that, now this is a very precise question. It means, are you taking the physiotherapy regularly? Is it regular and ongoing? And then you get the truth. It's like, well, I went to one, but I didn't go back. Okay. So this is why asking questions using correct tense forms can be important. Now, I know it is a small thing in the big communication, but remember, the small things add up, okay? And especially if you want to get accurate information from your patients, you have to be accurate in your language and very precise, okay? Okay, so here's a little mini quiz that you can maybe try on your own. And here's an example. So thank you for seeing this patient who was diagnosed with hypertension 3 years ago. Okay. The meaning here is that he still has hypertension. Okay. And think about what other correct forms would have the same meaning. And number 2, he is taking Ramipril. Your meaning that you want to convey, that you want to give, is that the medication is regular, even now. So what kinds of things can you say in these two that have the same meaning as here? Okay. So at this point in the video, you can pause it and just think about it. Okay. But now I'll give you the answers. So you want to convey that the person still has hypertension. You can say, thank you for seeing this patient who has had hypertension for 3 years. You can say, thank you for seeing this patient who has hypertension of 3 years duration. Now here you've used the simple present, but you're using this form, 3 years duration, means the same thing. Or thank you for seeing this patient who has hypertension. Yeah, okay. Right, so here we've got the simple present. We've got the simple present, but with this duration clause here. And then we've also had present perfect, giving the timeline. What you don't say is, thank you for seeing this patient who is having hypertension. For diagnoses, we don't use present continuous. You don't say he is having anemia, he is having hypertension, he is having diabetes. We just don't. We don't do it. It doesn't sound natural in English. Instead, we would say they have the diagnosis. We state it as fact. Okay. However, for symptoms, yes, he's having pain, he's having dizziness. For symptoms, present continuous, but not for diagnoses. Or we can say example 2, he is taking Ramipril. Our meaning is medication is regular, and we use simple present as well. He takes Ramipril. Here we're using it as a fact, or he is on Ramipril. This is a case where the simple present and the present continuous, as we saw before, can in fact have the same meaning. Okay, so that's it for me this morning. It's a little bit longer than 30 minutes, but that's okay. I hope you understand a little bit more about tense forms, how we use them, when we use them, what the meaning that people get and we get from the different tense forms. So in your study, then you can make sure that you get these right. Okay, so I'm going to stop screen sharing now, and I am going to say thank you very much.